morning. If you have type 2 diabetes and your doctor says it's time to start insulin, there are 2 lab tests that I would want to know about first. And just to be clear, I am only talking about type 2 diabetes, not type 1 diabetes. People with type 1 diabetes need insulin because their bodies are no longer producing it. But in type 2 diabetes, the question is often very different. Is your body struggling to make insulin, or is your body already making plenty of insulin and fighting severe insulin resistance? Let's talk about long-acting insulin. Long-acting insulin, also called your basal insulin, this is where they would start, works in the background all day and all night to help lower your blood sugar. Examples would include Lantus, Basaglar, Semglee, Toujeo. For some people, or many people with type 2 diabetes, insulin is necessary. Sometimes it's the safest and most appropriate treatment. But before starting a long-acting insulin, I would want to know 2 things. A fasting insulin level, not a fasting blood sugar, a fasting insulin, and a C-peptide level, because these labs can help tell us how much insulin your body is producing and whether your pancreas is still making insulin. Many people with type 2 diabetes aren't really suffering from a lack of insulin, they're suffering from insulin resistance. Their body may already be producing very large amounts of insulin, but the cells aren't responding appropriately. Now, that doesn't mean insulin should never be used. Sometimes insulin is exactly what you need, but understanding what's happening underneath the hood, so to speak, gives us a more complete picture. And even if insulin is started, the work is not over. Many providers will continue other medications like metformin because improving insulin sensitivity may help reduce insulin requirements over time. So the goal isn't just lower blood sugar, the goal is improving your metabolic health. That means, of course, building muscle, moving after your meals, prioritizing protein, food order like we talk about, improving your sleep, managing stress, and helping your body become more insulin sensitive. I've seen too many people think that once insulin is started, the story is over. It's not. Sometimes medication is just a bridge that helps carry you safely while you work on the deeper drivers of the actual problem. And I believe our bodies were designed with an incredible ability to heal, to adapt, and recover. When we consistently give them what they need, this can happen. If you're trying to better understand your labs, your medication, insulin resistance, metabolic health, you can head on over to lyndsaycarlson.com. I do offer lab reviews and medication reviews, educational resources. I do work with a small number of metabolic health clients who want a much deeper look at what's driving their numbers and issues. But follow along for more practical, root cause, metabolic health, education only, not medical advice. Never stop or adjust your insulin or your medications without speaking to your healthcare provider. If you have any questions, feel free to drop a comment below, or you can reach out on my contact form on my website, lyndsaycarlson.com. I hope you have a blessed day.